maternal health programs. We will be talking to you a little bit about both the maternal health program, because that's where the Doula Project lives, and then highlighting the Doula Project itself. So we appreciate you inviting us into your meeting and letting us shine a light on our project that we've been working so hard on. We know you guys serve the same clients that we are serving, so we very much appreciate all the hard work that you. Sorry, I just saw it looked like I got muted. I'm not sure where you guys left off hearing me.
Summer, we heard you say where you were from, and then you talked briefly about the project. The Doula Project is what you're going to talk about and your programs.
Okay. So yes, we feel like this project aligns very well with the work that you guys are doing in the clinics. We're serving this same populations with the same high needs. So we want you guys to have a good understanding of the project and who it is we're serving. So please feel free to ask questions if there's anything that you want clarified. And then B, I see you popped on. So if you want to also introduce yourself before we get started.
Yeah, of course. Good afternoon, everyone. I'm B. Sanchez. I am in the PRAMS data manager, and I also do the program planning for the Doula Project.
All right. Am I able to share my screen then? Do you want me to share the presentation, B?
Yeah, you can. I don't have any monitors here with me.
No problem.
Thanks.
Okay. I'm up. Let me just get it in share mode. Okay. Okay, are you guys able to see the PowerPoint?
Looks great.
Okay. All right, B, do you want to start us off?
Yeah, so the official name of the project is called Iowa's Title V Community-Based Doula Project for African American Families or Black Identifying Individuals. And this is a PowerPoint that we merged over into using it with some changes that we use for all of our new doulas that we onboard for HHS orientation. So minor edit there, we forgot to delete that new doula orientation part, but that is the official name of our project. We usually just call it the Doula Project for African American individuals.
All right, so as I mentioned previously, excuse me, this pilot project was embedded within our maternal health agencies who already is subcontracted to serve the maternal health clients and receive that Title V block grant funds. This may be something that you guys are already familiar with. I know a lot of you guys work alongside maternal health nurses within the clinic, so I'm not necessarily telling you guys anything new there, but I just did want to share this map because it does break down the different CSAs that we are working within. And then the stars are going to represent where the Doula pilot project was embedded in. So currently there's 15 of the CSAs, which is short for collaborative service areas. It was embedded within these specific areas because they already had that understanding of what the needs were within their community. We had done a needs assessment, and it was shown that that is where the highest needs were to meet the population we are going to serve. So right now it's currently in Blackhawk, Dubuque, Polk and Scott. As you guys know, the qualifications for the maternal health program is based on income guidelines. So the individual must be at or below 375% of that national poverty level to qualify for the program. And then for the doula project, the same would, it would be the same. The woman would have to be pregnant and then also identify as Black or African American. If there is somebody that's interested in being either a client of the doula project or becoming a doula within the project, they can always contact the maternal health agency that's within that specific county. Although it's embedded in the maternal health programming, this particular project does get a braided, has braided funding. So they're getting funding from the Title V block grant, some federal funding that's coming through the Preventive Health and Health Services grant, and then as well as some private funding from Mid-Iowa Health Foundation. And then here is a little bit more about the individual agencies that are providing the services. Do you want me to?
No, I can take this one. So in Polk County, it's Every Step is the agency there. In Dubuque, it's Unity Point Health or Dubuque VNA. And then in Scott County, that's the health department there. And then in Blackhawk, it's a little bit unique in the sense that there's two agencies working together to be able to make the project function. So the Blackhawk Public Health Department is currently holding all of the doula subcontracts, while Allen Woman Health actually has the maternal health grant and is making those referrals for the doulas to be able to see clients. So a little bit of a dynamic there just because of how the grants were awarded this year. And then here's a list of our key partners. Statewide partners is, of course, all of our community-based doulas. We'll talk a little bit about how many doulas we currently have enrolled in the next few slides. And then we just mentioned our local Title V agencies in our 4 counties. We partner and contract in a few different capacities with the University of Iowa for assistance. Dr. Lastasia Coleman played a pretty big role in the beginning of this project, just doing some of that research and getting it off the ground. And then we also contract with Dr. Deshauna Jones, who is our project evaluator. Mid-Iowa Health Foundation is a project funder, and Nayla Johnson, who was the director here, it also was a big part of the beginning of the project. And then on the HHS side, we have listed Marcus Johnson Miller, who is our bureau chief, Sylvia, who is our section manager, myself and Summer. Nicole, who I know is on the call, is part of our internal doula project team. Brings in lots of great different viewpoints from the WIC side, and then our epidemiologist, who is Debbie Kane. And then we just wanted to give a high overview of the project diagram. We obviously have our funders. Again, those are our 4 different funding streams this year. Probably will be changing here in the next year. But those funds go to Iowa HHS. We funnel them through our Title V clinics through our contracts, and then they're able to subcontract with our community-based doulas.
All right, so now we'll talk a little bit about what the project's goals are. So one of the biggest goals was to help decrease maternal mortality and morbidity. We do that by working to improve both maternal and infant health outcomes by providing culturally congruent support to pregnant moms, increasing hopefully earlier entry to prenatal care, and then offering a multidisciplinary support team by adding the doula as part of their birthing team. We are hoping to increase breastfeeding initiation rates, and we do that by offering education to our doulas who are in the program to become certified breast support specialists. We are hoping to diversify the perinatal workforce. So one of our goals is not only to have doulas provide that care to the clients, but one of our big goals also is to have more Black women be part of that perinatal workforce. So a big part of our project goals is to increase that workforce, so that if and when this becomes picked up as a Medicaid reimbursable service, that we already have this really robust, culturally congruent group that's already ready to take off and start supporting clients. And then we are working towards providing evidence to ensures that this is a reimbursable service for our clients. So we're trying to create a sustainable model for the doulas that are working in Iowa. We're closely monitoring the program data. As Bea mentioned, we work really closely with Dr. Deshauna Jones, who provides all of that data monitoring for us. And then we also have close contact with other states who have already implemented doula services as a Medicaid reimbursable service. So we're constantly, as other states evolve in what they're doing to better the services that they've already rolled out, we also will modify our program to meet that and mirror what they're doing and the successes that they found. And then I did want to also show you our Title V or maternal health healthy pregnancy program goals, because they are very similar. So again, our goal is to increase the percentage of infants who are breastfed exclusively through that 6-month time frame. Also to decrease the maternal mortality rate, to decrease the percent of women who smoke during pregnancy, increase the percent of infants placed on their back to sleep within that safe environment without any loose objects, so just totally by themselves. Increase the percent of women who have a preventive dental visit during pregnancy. So these goals are established through a Title V needs assessment. These are both a combination of national and state performance measures. So they're determined by doing that needs assessment on the community that we're serving. We do meet these goals by providing direct care services in partnership with our local communities. So that'll be the maternal health agencies that you guys are all working very closely with in your clinics. And we partner with them to provide those direct services and education and empowerment to the clients. We wanted to focus or do a highlight on these goals as well, because we do encourage that if a client is enrolled within the doula project at an agency, that they're also dually enrolled at the agency, so that a nurse and a social worker can also go in and help support the client with the doula, so that they're getting that full spectrum wraparound care.
So I've mentioned a few times how our doulas are subcontracted with our local Title V agencies. So our doulas are individualized business owners. So they have their own business, their own LLC, and then they sign a contract with the agencies to be able to provide services. The process from beginning to ending through this project is supported. We developed a standardized process to enrollment of the project for all certified doulas, certifying doulas, and the difference there is, so to become a doula, and Jasmine will be joining us here soon. I'm not sure what time she's going to be able to pop in here, but Jasmine Brooks is our Polk County doula liaison, and she will bring the doula perspective. But the way that doulas first get started is they go through a workshop, and through our project, we're able to pair them with a mentor to begin to see clients and help them build that experience and rapport to be able to gain a full doula certificate or certification. And so that it would be the difference between the certified and certifying. Certified meaning they have the full certificate, and then certifying meaning they have a current mentor that they work alongside with for help and support to obtain the full certification. So also part of the subcontract is various credentials, things like trainings, HIPAA training, mandatory reporter training. They obviously have to have a W-9. And then it kind of varies by agency what the requirements may be at each of them. They do go through a background check through us. And let's see here, what am I missing? If they have a breastfeeding experience or a class that they have taken, that obviously is also listed or taken into consideration as part of their credentials. Go ahead, Summer. Oh, yep, and then this is part of the credentialing. So again, the workshop, usually depending on what certifying entity they go through, we have 3 approved, which is National Black Doula Association, CAPA, and then DONA. Depending on each of those entities, they kind of have different rules as far as the package for submission to the full certificate. So again, the mentors are there we developed a mentor model for them to be able to assist them through that process. We also, part of that mentor model is skill building abilities or opportunities for new doulas to gain knowledge from a more experienced doula. And so just providing them with the most support possible, because we know that doula work can be a lot to take on. They have to carry their own liability insurance. Part of their certifying entity, they have to have a membership, what is called a membership through their doula agency. Again, I mentioned the background check, I mentioned the mandatory reporter, and then both of those, reporter and the HIPAA training, they go through that agency for do that, and all of it must stay current while they are enrolled in the project. Our doula services are broken up in 3 parts: prenatal support, birth support, and then postpartum support. We have kind of a minimum maximum amount that we encourage or ask doulas to meet with their clients. So for the prenatal period, we ask for them to meet a minimum of 3 times. During that time, it's expected or advised for them to go through the birth plan, go through any referrals that the family may have or need, go through health education topics, birthing options, and then facilitate a healthy communication between the client and the providers, make sure they're getting to their appointments. And then the birth, it is a current requirement that they are there in person for the birth. Worst case scenario, they're there for the birth virtually, but we highly encourage in person. And then that they stay with the client for the needs after 2 hours after the birth. The postpartum period is very similar to the prenatal support. It goes up to 3 again, and that is after 6 weeks of the delivery. And then most recently, what we have found is sometimes a client will enroll in the project further into or closer to the due date. And so what ends up happening is a client won't get the full prenatal support visits. They'll end up having either one or two. And so what we have been able to do is any of the visits that were not met during the prenatal part are able to be merged to the postpartum part, meaning if they only got one prenatal, then they're able to serve the client up to 5 postpartum services and get reimbursed for those 5. So this doesn't mean that they're not able to see clients anymore outside of that. It just means that our reimbursement rate caps at that amount, if that makes sense. Does anyone have any questions about that part? It gets a little confusing.
And this is something that we were able to kind of mirror off another state. We initially did not have the merging of the services. We just were doing 3 prenatal, birth, and then the 3 postpartum. And another state was doing this. So, I mean, this is beneficial for multiple reasons. The client is getting multiple touch points. Some people need more support prenatally. Some people need more support in that postpartum period. And then it also provides the doula to be able to have a little bit more security in knowing how much she is gonna, this is their career. So they're gonna have a little bit more security on knowing what their paycheck will be from client to client. That they can, if the client allows, get paid for those 6 total prenatal or those 6 total visits plus birth. But they will also provide support to the client through like texting and phone conversations, but those will not be necessarily a billed service. That's just like the maternal health clients and nurses when they're supporting those families, they will also be providing text and phone support. It's just kind of part of that care coordination that is expected when working within the public health community.
And then some of the project requirements, I mentioned mentorship. They also have to have a backup. So we understand life happens, and if you're out of town for an emergency and their client happens to go into labor that weekend, we explain to all of our doulas that they should have a backup for those emergencies, and that backup should have some feedback on the clients as they're meeting with them or an understanding of what that client's preferences are for the birth. And then we go through what the communication with the agency should look like, what the communication with the clients should look like. And we meet with all of the doulas quarterly at HHS level. And then the agencies meet with their individual subcontracted doulas on a monthly basis. And the way that we gather our project evaluation and our data is through surveys. So when a client comes through and signs up for doula services, they do what is called a pre-service survey, and that is questions on what the client's needs are, what they know about doulas. And so the next one, the next survey listed here is our REDCap survey. So this is how our doulas enter services into being documented. They use our system called REDCap, where we take each service documentation and measure the outcomes of prenatal appointments compared to their postnatal appointments and compare those. And then we ask our clients to also complete a post survey and a satisfaction survey of how they felt the doula services helped or didn't help during their pregnancy. So lots of surveys. We lean on lots of surveys. And then our current project goals, this is our second pilot project year. The project is set for 4 years, so 2025 will be our last year. This goal last year, I'll start with last year. Last year, our goal was to serve 40 clients, I believe. We ended up serving nearly 60, so we surpassed that goal. And then this year, our goal was to serve 100 clients in our 4 counties. And I'm happy to say we are nearing that number. Our goal is obviously to also provide or create sustainability planning for the doula services in this pilot project. We hope to be able to contract with a person to write a IME decision document to help support Medicaid reimbursable doula services for Medicaid members, and continue to evaluate the work and our outcomes, and then just continue to educate and build the doula workforce. We currently have 14 active doulas. We just enrolled 12 doulas. And so as we're enrolling them, helping them through the credentialing and having them sign a subcontract, we're able to serve more clients. So yeah, those are our current project goals. And that is all we have. Are there any questions? I know I talked a little bit fast. Jasmine, Nicole, I saw your message. So Jasmine said she could be on around 12:45. So we can open it up for questions. And then if it's a specific doula question, she should be joining us here in about 10 minutes.
Do you know how many doulas there are across the state of Iowa?
That's a great question. I'm sure Jasmine might have a better idea. What I do know is that there are several pilot projects. So some of our doulas are duly enrolled in different pilot projects. We know that Iowa Total Care has a project. We know that the new MCO, Melina, is interested in starting a pilot project. And then we know that Johnson County is starting their own doula pilot project. So lots is happening. We know that there are several trainings happening from the Iowa Black Doula Collective. I know that there was one this month, and we're having at least one doula join our project from there that I'm aware of. And so it's a growing workforce. And I think that's the focus right now in all of these pilot projects that are happening, is we're trying to, find the culturally congruent persons that are interested in becoming doulas and helping them get that training and helping them with their support in becoming a doula.
So there was a question put in the chat. Are you planning on expanding the program out of the current service areas? And as of right now, within our Title V pilot project, we won't be expanding the service area. But what our goal is in providing what B mentioned, that IME, is to show that there is that need. And if you look from year 1 to year 2, we doubled just in focusing on that specific population, the number of clients served, as well as the amount of doulas enrolled. So with this current project, because it is so population and service area specific, we unfortunately can't. But hopefully by proving its need and worth, we'll be able to expand it much more. We don't necessarily know what the project is going to look like when the project period is over in relation to the state's involvement. But we continue to have those conversations, especially with funders and all of our support team.
Yeah, that's kind of what I was going to add is funding. As far as this pilot project, we're only able to do so much with the funding that we have. And so as much as we would love to expand to more counties or even opening it up to serve more populations with high needs, we unfortunately, are kind of restricted there with the amount of funding that we currently have.
Mm-hmm.
So there's another question in the chat, and that says, are the doulas only paid by Medicaid reimbursement? So I'll stop there and answer that part first. So right now, this pilot project is not paid by Medicaid. This is paid by 4 different funding streams, and I'm happy to tell you what those are. We have block grant funding. We have Mid-Iowa Health Foundation funding. We have COVID health disparities grant funding. And then missing one, we have erased maternal mortality and morbidity. And that is a CDC grant. It's an internal grant that we have here at the state. And our co-worker 70 trustee is the grant administrator for that. And we were able to work together for her to be able to fund the project through her Erase MM funding. So we have 4 different funding streams next year. That will change, that we will be losing at least one of those funding streams. And it was a COVID one just because COVID funds are ending. But having to kind of shift and move things around, that's kind of where we're at. And so doulas are paid out of those 3 or 4 funding streams. And then the rest of the question says, is there an incentive for on-call pay if they need to be on call around the due date in anticipation of the delivery or when problems come up? So unfortunately, no, there isn't an incentive to be paid to be on call. That's kind of what doula work is you basically, the expective is for you to know your availability, say 6 months down the road for when your client is due, and know that if your client is due at the end of December, you don't have any traveling plans and you would be available to be at the birth. So there isn't a specific on-call pay for doulas. And we have had lots of different situations come up in regards to like issues or problems like fake labors. So we've had a doula be with a client at the hospital for several hours, and the client ended up being sent home. And so it does come up when we do have to sometimes do case by case reviews and just conversations around how do we reimburse doulas for their time, and how do we make it equitable? How do we both let them know that their time is valuable, but also make sure that they're gaining that knowledge and experience so that they're not at the hospital as soon as a client feels like she's going to go into birth, if that makes sense. So a lot of it with the pilot project is kind of trial and error, and also making adjustments, making changes, writing new guidelines, building on policies, and like Summer mentioned, talking to different states and colleagues, and just learning how to best handle problems and issues that come up, because they do, they happen quite often.
There was another question in the chat. What feedback do you get from families who have had a doula? And in our program, like Bea had mentioned, we're working with Dr. Deshauna Jones, who evaluates all of the surveys that are done. So we have the client fill out a pre-service survey as well as a post-service survey so that we can kind of gauge when the client came into the project, what their level of knowledge was regarding our specific goals, like how to put a baby to sleep, what your level of knowledge on breastfeeding is, and those kind of education questions. And then in the post survey, we ask like where your knowledge is now, as well as your experience with the doula. And all of them have been very positive. They've all had increased knowledge and confidence in caring for their babies. I don't think that we've had one negative experience within the survey results. So people are finding that the doula is bringing them more comfort in their birthing journey, as well as more confidence in being a parent and caring for their child.
So just a few things that come to mind when we're talking about the satisfaction of doula services from our clients. One thing I think back to reading a lot of is the how much comments there were on the support that the partner received, or the education that the partner received that wouldn't have happened if they didn't have a doula. And then the other thing that also comes to mind is on the negative side is most participants want face-to-face. They don't want calls, they don't want texts, they don't want to meet virtually. They want a person there to be there for them, to hear them, and to offer that emotional and physical support. So that would be the only thing I can think of that was kind of something that we are trying to stay away from, is encouraging the virtual piece.
The next question was, how do physicians and midwives feel about the doula pilot program? So we have had really good experiences with feedback from physicians and midwives. Just like when you have, your nurse in the room with your providers who are catching, the nurse provides a totally different level of support and eyes for the patient. And then the doula will provide that same kind of cascade of support, because their focus is different than the physicians and the midwives. The doula is not there to catch or do any of that kind of hands-on work. The doula is there to kind of take that load off of that birth team to be able to provide that client with that emotional support and trafficking of questions and helping them understand what's happening. So we've had positive feedback. I do think that there still needs to be work done within our birthing hospitals on the importance and the benefit of having a doula in the birthing room. We do find, which we understand we can't change hospital policies overnight, but doulas do tend to be kind of pushed out of, like, if they go into an emergency C-section, which would be a very important time to actually have the doula present, because that is such a high stress, confusing time, especially if you think you are going to have a natural delivery and then all of a sudden you're getting whisked into the operating room. So we do still feel like we need to have a little bit more education to our providers on the importance of the addition to the team. But where we've had doulas so far has been very positive. do they value having patients with doulas? I think I already kind of answered that question. I think there are some doctors that really truly understand it, and then there are some doctors who will never change their mind from when they graduated medical school. So, it's just, we are still teaching.
Yeah, and something that we began this year, so the fall, we began what we call doula liaisons. We currently have 3 doula liaison, 1 in Black Hawk, 1 for Polk, and then 1 for both Dubuque and Scott. And their role is to help build that bridge between the doula world and the provider world, and help just educate providers to better understand what the doula role is and how much value they bring to the birthing team. And so our liaisons do have a separate contract with the agencies. They do get reimbursed for their time to be able to go out to the clinics, meet the providers, set up meetings, make presentations, or whatever the provider prefers. And so we're continuously working to educate providers and providing them with that information, because a lot of the time there's a lot of confusion on what the doula role is.
This would be a perfect time to segue into Jasmine, because she is here now. So if we want to turn it over to Jasmine Brooks, she is able to speak on that liaison role for us.
Of course. Hi, Jasmine.
Hello, V. Hi, everyone. Good to see you all. Hi, Summer. And thank you, Nicole. Good afternoon. My name is Jasmine Brooks. I am a certified doula with 2 national doula organizations, the National Black Doula Association, as well as the DONA group. And so, I'm the liaison for Polk County. My role is, really relative to outreach and really helping to promote the program in different spaces. So connecting with our providers, connecting with, local community organizations that do position themselves to support pregnant folks throughout their antenatal period. We also try and position ourselves as educators. And so offering opportunities for the doulas to talk about lactation, to host peer-led spaces, to, go to events, those types of things. So trying to really optimize their skills. A lot of them are coming with so many different skill sets and levels of education. And so really trying to make sure that they're not, just birth workers, but they're, doing a lot of other wonderful things that our community can take advantage of. So as example, I run our childbirth education series at Every Step, specifically geared towards the Black families that we serve here. I'm excited to be here. Is there anything specifically I should talk about too?
Someone earlier, sorry, I was just going to say, someone earlier had a question about approximately, if you had an idea, how many doulas there are across the state.
Oh, great question. I think, B, you know that number more than I would. I think we're sitting at around a little under 20 within just Polk County.
For our project specifically, yes. But I did mention there's several projects happening.
Yes, there's lots of doula projects, and Medicaid, some Medicaid spaces like Molina are growing and their doula projects as well. But and our doulas work with this project and other projects as well as managing their own business as doulas. So some of them are just fully immersed in doula work, and other doulas carry full-time or part-time jobs. We're all varied. So that's a great question.
There also was a question I thought you could potentially give a little bit of a different light on, Jasmine, was how do you feel physicians and midwives, how they feel about doulas being present in the birthing space, and do they see value with patients having a doula? What has been your experience with that?
Yeah, that's a great question. I think, doula work is having a doula is still a deep privilege, and oftentimes unaffordable. And also too, just because there's doulas out there doesn't mean they're taking everyone, because doulas experience burnout just like a lot of other jobs. But most times, professionals, service workers, providers, they don't know what a doula is. They don't know what a doula does. And, oftentimes we're meeting them, the day of labor happening. I do also experience a lot of nurses, knowing what a doula is because they had one themselves. That's commonly what I experience. But there's still a lot of education needed about like what doulas do, and how we support our families. But I do experience, providers really appreciating that their client has a doula, because we stand in the middle of a lot of things between their families, their communities, and their service providers. We're the ones making sure they're getting referred, going to their appointments, supporting them, educating them, guiding them, providing that emotional and mental support throughout it all, right? And I always emphasize like doulas, as much as we are there through 6 to 12 weeks of their postpartum, a lot of times they become family. So for my clients, like I am with them through the first year of life, oftentimes, and even beyond that, because we've been so close and connected, and we've helped them and shared so much culturally that it really, for them, they see us as another layer of community. But yeah, there's a lot of work to be done. I see another question in the chat about doula work. So doula work is global. I will say that global, it's not national. There are a lot of doulas even moving across across continents. And they're sharing their experiences at working with midwiferys and OBs in other countries. But yes, where it gets iffy is if Medicaid is part of that state's reimbursement. Some training bodies are not covered as fully reimbursed certifications. So if, like, for example, our DONAs, our CAPAs, those are the, ones that have been around for ages, compared to like Birth Arts, National Black Doula Association, where they're new and having to, fight the state to include them. And so that's why we're working hard in Iowa to provide that diversity of education, because, knowledge is power, and learning in one way and one set way really just doesn't allow the community to grow in the way that it does. And so this year we've offered the doulas to choose what, education they want to go to. And that's been very successful. You see the growth in knowledge in the space of folks coming at it from different angles. Like, for example, I was trained by a Black midwife. That provides a whole different experience in the space and how I share and educate other doulas. But yes, once they're a doula, they are a doula for life, whether they take clients or not. But yeah, you can go anywhere to be a doula. Approximate cost to have a doula in Polk County. So through our project, the clients do not have to pay. But as far as like taking a client privately, that range could be between $400 to $1,700, depending on that doula's experience and expected costs and length of time working. Not all doulas take all clients. And so some doulas only take clients that start, they would start at like 26 weeks or so. Some doulas take clients at 9 weeks. So we're really seeing people coming in at different times. But naturally that cost does not change just because that client may come in at 37 weeks. I know that feels kind of crazy, but what we do is tack on that support, again, in a private setting, tack on that support in postpartum. But again, in this project, the clients do not have to pay for any doula services. All great question. Any other ones? Sounds like B and Summer covered it really well. Did you all talk about like how to support the project at all? I'm not sure.
Yeah.
Oh, go ahead.
We did talk about that briefly, but if you had anything to add, you can go ahead.
Yeah, I think, because like knowing like doula work is not like it doesn't look the same in every culture. So like if you work from a family from the Congo to a family from St. Louis to, you know, again, these families, they're going to know about doula work, but not in the label of doulaing. That's specifically an American experience. And I want to say that because we're talking about like getting a doula and support, like breaking that down of talking about we provide emotional, physical, you know, informational support to clients and what that means, right? Like we're walking them through capturing different like things to help them understand what they can do to advocate for themselves. We're stepping in complicated scenarios where providers aren't listening. They're not honoring the birth person's needs. And we're making sure that they're all prepared for that as a family. So even within postpartum, we are helping to assess if there are any additional referrals that they may need. Obviously, if it's a home visiting situation like our program, we try to make sure that they're connecting and you know, telling the providers everything. Like sometimes my clients tell me things that they don't want to tell anyone else because they're unsure of the response, they're unsure if they'll be embarrassed or shamed. And so we're really helping to like, you know, be that supporting guide. So knowing that like talking about it and emphasizing exactly what we do and not just saying you need a doula. Like people don't know what that means, again, because it's a luxury and it also isn't a transcultural experience. So and a lot of times people too are concerned about a doula being so immersed in their life because some things may be happening, good or bad, that they may not feel comfortable with a person. And so knowing that they can consult and interview doulas. So say they weren't able to decide what doula they wanted, or if they even wanted a doula, they can interview with doulas that will be available for their due date. And those doulas will be able to share with them what makes them, you know, different and special and what skills they bring. And that way the client can decide, oh, I really like that this person does a lot with mental health. I'm actually this, and this. So this feels like a really good pairing, right? But yeah, I think that could be really good if you're positioned to like work with clients that will be referred. That helps us a lot. And also, if you have a special skill, I work with the other liaisons to host development for doulas. So like we've had a Black dentist come in. We're doing a 2-hour lactation education training. We're doing tours for hospitals and then private spaces that have clinics. So if there's opportunities for you to come in or for us to come to you, I would love that as well. And I'll put my email in the chat for folks.
There was another question. If we know someone who would like to become a doula for your project, who would they get in contact with?
Ooh, great question. So kind of a couple of things. I think we don't have funding to pay, but there are always like scholarship opportunities. I know of a few doula trainings that are happening physically and virtually. So you can always email me and I walk through with people like how to look at, doula trainings, how to apply for scholarships if they have a marginalized identity. But yeah, I think once they get the training, they can just come right on in.
Yeah. Yep. So specifically for this project, I would say probably start at the agency. Usually a maternal health director there has that initial contact with the doula and really that initial conversation to see if this person understands what becoming a doula entails, because it's a lot of work. And Jasmine, I don't know if you want to say any more about that, but a lot of the time, they're excited, they want to join, and then they realize, it's 3 a.m. and I have to go to the hospital.
Yeah. So we've done a great job this year of like having pre-conversations with all the interested doula, like folks who have not had training and are interested, to have candid conversations about like what doula work is and how it looks like day to day, month to month, year to year. we also have, you know, the MCH director, program manager coming in to talk about it from the side of the program, because it really is like a lifestyle, like to think about, particularly too, if you have children, if you have other like familial responsibilities. Like I'm in my PhD, and so you can imagine what my life looks like right now, trying to like move. Well, I don't take clients right now, but like back in the day, moving from class to a birth, back to class and paper. Like I also carry a full-time job, so like explaining to them, like if their vision is to be a full-time doula, like there's a process to it. We try to be as candid as possible, but it is hard work. It's hard work on the mind, body, and spirit. There's a lot of times we're losing babies because we know the rates of, you know, issues regarding infant mortality and maternal mortality and morbidity. And so that hits the doula hard too, and that sometimes causes us to take breaks. Commonly doulas take about, you know, 2 to 4 or 5 clients a month. So we're looking at, you know, a big caseload oftentimes. And so, yeah, we try to make sure that they're coming in really easy, and you know, making sure they have a mentor. That's what's nice about our program too, is they get paired with a certified doula to help guide them, making sure they're making all the right choices, and, you know, helping them cross any barriers to setting up their business, to, you know, getting certified, to, you know, creating a process to take clients. And we're all at different spectrums of that. Like for me, I have a client management system, so my life is a little easier than a newer doula. But we are not, everything we build that you meet with a doula that may be really seasoned did not start off with those things. And so, and then there's a lot of barriers, having a marginalized identity. You may not have access to those things to be able to, you know, fully support your client. So yeah, letting them know all of what is in front of them, but we can't ever prepare them. What happens is they learn about how hard it is during their training. So by the time we would have paid for it, they would have invested in it. And now they're like, wait, I don't know if I'm gonna do this. So in reality, is like we can tell them all the things and they're still excited because, you know, they may have had a hard birth. A lot of people come in because they've had, you know, either a really bad birth experience or a really good one, and they want to just provide support to someone. And then we have a lot of doulas that do not have children, like myself, but are, you know, coming to this work out of passion. So trying to meet people where they're at, not trying to be Debbie Downers, because again, providing support to a client takes a lot of energy. It's a lifestyle. It can really impact your relationships if you're married, if you have children. You can't travel as much, right? Because you have to be on call. And being on call is, you know, between 37 weeks to 42 weeks. That's a long time to be sitting in the house waiting for a phone call. But yeah, we are very dedicated to our clients, very dedicated.
Well, thank you so much, Summer, B, and Jasmine. It looks like we're at the hour, so we appreciate all your insight on this topic and hope to see success with the program continue. And I'm glad we were able to speak to this to all the local agency staff. So thank you, everyone, for joining us today. And we will see you soon. Thanks.
Thanks.
Great day, everyone.